Welcome, everybody. Today, I'm very pleased to bring you a conversation with Dr. Georgia Eade, a psychiatrist who is applying metabolic health and nutrition to helping people overcome psychiatric conditions and mental health problems. So, welcome, Dr. Georgia Eade.
Thank you very much for having me. It's great to be here.
My pleasure. I feel like I'm in the presence of a star because you were recently on the Diary of a CEO podcast. That was a fantastic episode, I have to say. That was really, really impressive and so good to see you share this message in the mainstream.
Well, I have to give a lot of the credit to the host, Stephen Bartlett, for being so well informed about these topics and for asking such great questions,
Mm.
and allowing me to reach new audiences with this information, which I hope is helpful.
Yeah, I'm sure it has been. I mean, hundreds of thousands of people have watched that episode, if not millions. So I'm sure it'll make a big impact. I would like to say the moment when he asks you about fiber, and then you just hit him back with, I think you just said, why? Why is fiber important? And he sort of thought, well, that's what everybody says. That's true, right? And then you explained that it's not an essential nutrient.
Yeah, so that moment in the interview was interesting because I wasn't trying to I wasn't really trying to put him on the spot. I was trying to ask questions that would draw out the typical beliefs about fiber so that we could then kind of pull them apart. So, and just kind of starting with that basic question, well, why is it that we believe that we need it? And to go through the different arguments about the different things you hear. Well, isn't it good for digestion? And isn't it supposed to be good for your microbiome? And isn't it supposed to help with blood sugar spikes and things like that? And it was nice to be able to pull those arguments apart because when you look underneath them, there isn't any, it's all based on either untested theories about hypotheses, really, about why we think we need fiber rather than actual clinical human evidence demonstrating that we absolutely do need it. Or it's or the benefits of fiber um, are have been shown, certain benefits of fiber have been shown in clinical trials in humans to benefit you if you're eating a diet that gives you blood sugar spikes that then need to
Mm,
be dampened by fiber. So fiber does. One of the things that fiber can do is that if you are eating a diet that's too high in carbohydrate for your metabolism and you've got too much glucose coming into your bloodstream at once, fiber will slow that down and will soften those glucose spikes. But of course, you wouldn't need that assistance from fiber if you were eating in a way that promoted healthy blood sugar levels in the first place. So it's these beliefs about fiber, many of them are half truths. Yes, it's true that it softens blood sugar spikes, but where are those blood sugar spikes coming from in the first place? There's a much more effective way
mm,
to manage blood sugar spikes is not to have them in the first place. And so one of the things I've really worked hard to do in the book is show people these half truths, these beliefs which are partly true about fiber, about vegetables, about about meat. There are lots of different there's enough truth in each of these myths that it will really carry that information. It's carried that information around the world 100 times over because there are kernels of truth in it. And so,
mm,
unless you say, yes, that's true, but, or yes, that's true, and what you might not know is, well, how that study was actually conducted and what it actually shows and what that diet was being compared to. So part of the fun of nutrition science for me is digging into the research to discover what it actually shows so that people have the whole truth, not just a half truth. And then they can use that information to make their own decisions about what they want to eat.
mm. Yeah, it's so refreshing to hear somebody go into the whole truth, as you say, rather than just taking these kernels and exacerbating the possible damage. Because we know that eating a lot of fiber can come with a whole host of issues for people as well. And a lot of people with IBS and similar gut conditions find that it goes away when they remove the fiber. yet they've been told this whole time that, fiber is healthy and fiber is essential for their gut. So it's nice that you're sort of uncovering the whole truth there.
Well, the thing what it does is if you look at what information actually does exist, it allows you then to say, well, we actually don't know. There's actually no way for us to know. There's no study I can point to that demonstrates that fiber is bad for everyone or good for everyone or necessary for everyone or unnecessary for everyone. That those studies just don't exist. And because they don't exist, it allows us to set the studies aside and do our own
Mm.
experiments to see what level of fiber you personally tolerate and wish to consume. And so if you feel your best without any fiber at all, there's no scientific evidence that that is necessarily harmful for you. If you feel better by including some fiber in your diet, there's no evidence I can point to that says that's going to worsen your gut health, right? So I think it allows you then to use the wisdom of your own experience and gives you the flexibility and the freedom to determine your own personal level of dietary comfort with fiber. And but what we do know, if you look at the biology of the gut and the biology of fiber and digestion, it's very clear that all of us have a limited capacity for fiber, right? So, and if a human being eats too much fiber, that's going to be a risk because we can only handle a certain amount. Where our guts are not designed, the physiology of the gut is not designed to be able to handle a very high fiber diet or a mostly fiber diet the way an herbivore can. So we do know that, but where your personal comfortable threshold is, I think, very individual.
So not many psychiatrists are talking about nutrition or metabolic health. How did you come to discover the link between what you eat and how you are emotionally and how it affects your psychiatry?
Yeah, I honestly had no idea that what we ate was important to our mental health. It really never crossed my mind because I wasn't taught it in medical school. I wasn't taught it in 4 years of medical school, 4 years of specialty residency training in psychiatry. We didn't talk in over that course of those 8 years, we didn't talk about food and the brain once. So when I started practicing psychiatry, I had absolutely no idea how important it was and how critical it would become to helping people not just improve their mental health, but sometimes even recover from even very serious mental illnesses. I was not taught to aim for or expect recovery.
Mm.
I was taught to expect chronic, incurable illnesses managed to a certain extent, if you were lucky, with medications, psychotherapy, sometimes hospitalization, and that these were illnesses that we didn't completely understand. They were mysterious and maybe rooted in chemical imbalances that we don't have tests for, and to use trial and error medications to bring some measure of relief. That's the way I was trained, and that's the way most psychiatrists are trained, and that's the way most psychiatrists still practice today, is this trial and error, biologically blind approach to psychiatric
Mm.
conditions. And so I never had any idea that food mattered. I didn't, I never had a single lecture in brain metabolism, didn't understand how biochemistry, all the biochemistry classes that I took in college and in medical school, how important those would become to my practice. So for 10 years, I practiced the standard way, medications, psychotherapy. And, any mental health practitioner out there knows this. Most of your patients just don't get that much better. Those strategies do help. They can help some people. And so I don't want to throw the baby out with the bathwater. I just want I just want clinicians around the world to know that if you don't have a good, solid nutritional and metabolic foundation for whatever treatment you are going to be using in your practice, you're missing, I think, the majority of the power, the majority of the therapeutic power available to you. So if you
Mm.
don't start with a healthy brain, um, then you are starting behind. You're really not going to be able to achieve uh, the mental health outcomes that you're hoping for. So if you have an unhealthy brain and you add medication to it, the medication may help to reduce symptoms, but it's not going to heal the brain. If you have an unhealthy brain and you do psychotherapy, you're not going to get the same benefits out of that psychotherapy as you could if they're starting with a healthier brain. So we have to understand what a brain healthy diet is, because the information we've been fed about what a brain healthy diet is supposed to look like is simply incorrect. It's incorrect. And so it's almost upside down and backward from what the truth is about what the brain needs to thrive. So when I was practicing this way, 10 years practicing the typical way, it was really frustrating and for both of us, both me and my my patients, um, but also heartbreaking sometimes, honestly, because I felt, I don't know what else to do. Sometimes I would have tried, 10, 15 different medicines, and nothing was really helping some of my patients enough for me to feel like I'd made any progress. And so it's really, really
Mhm.
demoralizing to have all that specialized training and still not be able to help people and not be able to give them a reasonable or sensible answer to a very reasonable question, which is why, why do I hear voices? Why am I depressed even though my life looks okay on the outside? Why am I so anxious when there's really no good reason for me to be anxious, right? So it was just really frustrating. And so then my own health problems came about in my early 40s. I was chronic pain and migraine headaches and IBS symptoms and things like that. And so things a lot of my especially my middle-aged patients were dealing with that I had absolutely no idea how to help them with. And now it was me, dealing with these things
Mm.
and not understanding how, what was causing them or what to do about them. And I had every test. I was working at Harvard at the time. I had access to great clinicians, specialists, all kinds of fancy tests. Um, Everybody said there's nothing wrong. So they all gave me the same sheet, go home and eat your high fiber, low fat diet and exercise, right? And so, which I was already doing. I was
Mm.
already that way, and I was already exercising 6 to 7 times a week, really quite intensively, running and lifting weights and all kinds of other things. So I didn't know what else to do. And so I just started instinctively experimenting with my diet. And so trial and error, 6 months later, food and symptom journal. This was back in 2007, 2008.
Wow.
And I didn't know anything about paleo diets, never heard of a ketogenic diet. I just didn't know anything about nutrition. I was just trying to see if the IBS symptoms might improve if I, you know, experimented with my diet a little bit.
Yeah.
That was the only thing I could think of to do. And long story short, 6 months later, all of my symptoms were gone. I felt the best I'd ever felt physically and emotionally and cognitively, even though I wasn't even trying to improve my mental health. I w didn't even think of my mental health as anything that needed improvement.
Mm.
I mean, I had my share of, winter depressions and depressions after breakups and things like that, and anxiety on Sunday nights before a week of work, and I'd had my share of what we think of as normal, like low energy at the end of the day, feeling sleepy between meals. I'd had my share of those things, but I thought of all those things as normal. And I think most of us are walking around with suboptimal mental health and thinking that that is the best we can expect. And that got my attention. It was one thing. It was one thing for the IBS and the migraines and the pain and the fatigue and all of that to improve. That was one thing. I mean, that was a big thing. But what really got my attention as a psychiatrist was my mental health is noticeably better. My mood, my energy, my mental stamina, my concentration, my productivity, my sleep, my ability to tolerate stress, all of those, my mood in the wintertime stayed good. It didn't go down in the winter the way it always had
And,
before.
and at this stage, you were doing paleo, or what was your diet?
Oh, sorry. So the diet that I ended up with was a mostly meat, very low fiber, very high fat
Great.
uh, diet, and it eventually became a ketogenic diet. At that
Hmm.
point, it was a very low carbohydrate. I wasn't measured, didn't never heard of a ketone.
Hmm.
I wasn't measured ketones. But it was a diet that was extremely low in fiber, high in fat, mostly meat, seafood, poultry. Unfortunately, I'm sensitive to eggs and dairy, so I didn't include any of that. One of the things that I discovered as I was doing my food and symptom experiments was that I had a lot of food sensitivities, and that when I took certain foods out, I felt an awful lot better. And then I put them back in, I felt a lot worse. And so that was just trial and error. And one of those things was dairy, another was eggs. So some people do better with those than others. So it was a really very limited diet, very strange diet. But it worked like a charm. But based on the very little I knew about nutrition at the time, I thought, well, this diet should theoretically kill me. I can't recommend this diet to my patients.
Mm.
I need to understand why would this
Cholesterol,
diet
heart disease, bowel cancer.
exactly cholesterol, heart disease, and colon cancer. These were some of the things that I expected, to be the long-term outcome of eating a diet this way. So in the
Mm.
short term, maybe it's great. Maybe in the long term, it's going to kill me. But I got curious. I was like, okay, well, if this diet has been so uniquely and profoundly healing for physical and mental health, and yet it's supposed to be really bad for you, what is it that I'm missing here? So what happens if I don't eat any vegetables at all? Or what happens if I only eat two or three as opposed to the entire rainbow of fruits and vegetables? Why do we think that? So let me find out where that information comes from. Why is red meat bad for you, but nobody really talks that much about white meat? What's the difference between the two of those? Why do we need fiber? How much do we need? What does it do? You know, all of these whole grains. Why are refined grains bad for you, but whole grains are good for you? I was so confused, and I thought, I got really curious about nutrition, and I started studying it independently, intensively. Some may say obsessively.
Yeah. Wow.
I just fell in love with nutrition science, and I couldn't wait to get home from my day job every day and dive into another paper to understand, to get to. I really love getting to the bottom of things. Psychiatrists like getting to the bottom of things. So, can I figure out what's going on here? And so, as you and now so many other people have also discovered, most of what we're led to believe about nutrition is wrong. It's flat out wrong. There's no there there. And so that really, and in fact, the opposite, almost the opposite is what's true. And everything's upside down and backwards. And so when you turn your diet around in these ways, people can experience profound healing, sometimes of even very serious chronic mental and physical conditions that are generally thought of as incurable.
Mm.
And so it's a very powerful intervention. You know, if you apply the truth about nutrition and combine that with the cutting edge science of brain metabolism, the powerful relationship between your glucose levels, your insulin levels, your mitochondrial health, how much and your brain's ability to produce energy smoothly and reliably and efficiently. You put those two concepts together, nutritional psychiatry and metabolic psychiatry, you have a really powerful tool at your disposal.
Mm. Absolutely. So when you've discovered this and you've started experimenting on yourself, and you went into this nutritional experiment trying to heal other things, not necessarily your brain, but then you started to notice, hey, some of the sort of depression or negative thoughts or voices or anxiety has gone away, um, which I can totally relate to, by the way. I didn't start the carnivore diet thinking I'm going to get this wonderful mental health benefit. I thought, I'm going to have energy and I'm going to be in great shape. But then when you actually do it, you're like, oh my, I don't have those negative thoughts. I don't feel anxious. I feel quite happy. And and I've experienced the exact same thing. When those foods do creep back in, you start to hear I start to hear some negativity or some worry about things or some bad things about yourself. And you just need to know that it's the food. So when you discovered this link, you must have been tempted to let people know or to somehow incorporate this into your practice. What did you do? It's like you've got this, not a silver bullet, but you've got this solution that might really, really help people. And you've at the same time, you've got the government dietary guidelines that are saying essentially the opposite of what you've discovered. They're saying grains, fiber, fruit and veg, low fat, low red meat. How did you reconcile those two things?
Well, I took a good long time to do it because I really didn't want to be irresponsible. I didn't want to be put my patients in danger, and I certainly didn't want to lose my license. So
Yeah.
but plus I just really didn't understand enough yet. I took, I think it may have been 2 or 3 years of studying very intensively before I started to incorporate. Back then, what I started with was incorporating paleo principles into my work. I was working at Harvard at the time, and and I had been hired, as most psychiatrists are, to manage medications, right? To offer medication services. Therapists of various kinds, psychologists and social workers and so forth, were hired to do psychotherapy. Psychiatrists, medical doctors are hired to prescribe medications. And so that was my main job there. But I was allowed, as many of the rest of us were also, to also pursue other um, other avenues of treatment that were of interest to me. So, for example, somebody on the service, another psychiatrist on the service, was interested, for example, in acupuncture. And so she was able to advertise to students and faculty and staff that she, in addition to medication management, also offered acupuncture.
Nice.
I was allowed to say I also offered nutrition counseling. And so people would come to me if they were interested in it. And at first, that was how I began, was just only those who came for that service would receive that service. Everybody else, I kind of left them alone. And if they came for medication, I prescribed medication. But as you say, it starts to become difficult not to want to mention this to other people because you see the limitations of the medications that you're prescribing. People come back, you know, 1 year, 2 years, 3 years later, you've tried different medicines, nothing's helping very much. You start to feel as though, gee, I really wish, I wonder what would happen if this person would be willing to try some dietary interventions, right? And so what ultimately ended up happening was I started to feel excited about sharing these strategies with other people, even those who hadn't asked about them. And I made lots of mistakes in my early years of practicing this way, um, including being overly kind of evangelical about it. Yeah, I was just really excited about it, and I wanted to share it with patients, and not all patients were interested. And I've since learned a lot about lifestyle counseling and understand, where that line needs to be. But but long story short, my I gradually began incorporating more of these principles into my work with more and more patients. And I started a private practice on the side, which was entirely dedicated to nutrition counseling so that I could really offer to everybody who came in. And I'd been in college mental health. That was my specialty for 12 or 13 years.
Yep.
I eventually left college mental health because I couldn't practice the way I wanted to practice with most of the people who were coming to see me because most of them were either not interested or they were, of course, university students are living in a culture, a very unhealthy food culture
Junk
where
food,
it's very,
alcohol.
very difficult. It's really hard to change your diet in college.
Mm. And the private practice, was there interest at the start? Was the public aware that there was this incredible link between nutrition and psychiatry or mental
Well, the
health?
public wasn't aware, but I had started a website and I'd started writing about, the various, as I started studying nutrition, I started sharing what I was learning publicly on this website. And this back in 2012, I think that I started the website. And that was around the time that I opened the private practice. And so some people knew about this service through the website or through word of mouth. And so it actually wasn't difficult for me to find, after about a year or so, wasn't difficult for me to find people who were interested in this approach.
Mm.
And ultimately, I left college mental health and offered full-time nutrition and metabolic psychiatry services privately. That was starting back in 2013. 2018. So 2018, I left my Smith College and opened a full-time nutritional and metabolic psychiatry practice.
Fantastic. And what was the diet that you recommend people adopt?
Hmm. So it depended very much on what they were willing and interested to do.
Yeah.
And also with their goals and their metabolic health. So for some people, it was paleo principles. For some, it was gluten-free. For some, it was low carb. For some, it was ketogenic. Carnivore didn't come along until much later in terms of my nutrition counseling. So it was very much personalized to what people wanted to do. But as I became more experienced and recognized the profound benefits of ketogenic diet as opposed to other dietary strategies, I used that more and more and emphasized that more and more in my clinical work. And then
Mm.
eventually carnivore diets became part of my clinical work, and people came to me specifically either to start a carnivore diet or to troubleshoot their carnivore diet, which I learned a lot from those consultations and work with patients. And so it's been many years of clinical practice, and I learned from I still see patients, not as much as I used to, because I've been busy with other things, but with research and writing and speaking and so forth, and teaching. But I still see patients, and I still learn from every patient I meet.
Mm.
Um, there's still so much that we have to understand about nutrition and mental health that remains to be discovered.
I imagine when you were recommending a ketogenic diet, there were no grains and definitely no gluten recommended there because I've seen in so many people simply removing gluten and or wheat is like the ultimate low-hanging fruit.
It is, if there's, there are a few things that no human should eat, and grain is one of them, whole or otherwise. There's just no biological reason to consume grain unless you have no other choice.
Mhm.
It is all risk and no benefit. And so, unless you need the calories and you can't get them any other way, and there certainly are, unfortunately, places in the world where that's the case, everyone else who has the luxury of the choice, I would strongly recommend that they avoid all grains, whole and refined.
Absolutely. And the gold standard, I mean, obviously, this program is called How to Carnivore. We believe a ketogenic carnivore diet is the gold standard. And, primarily red or ruminant meat, that is sort of where we steer people because we find it's got the perfect nutrition, it's high in fat, so you're in ketosis, and there's very little impact from what the animal's been eating. For example, with chicken and pork, we find that some of those people have issues with the, high omega-6. What is your thought on the sort of gold standard diet?
Yeah, no, I tend to agree with you. And the only caveat I'd add to that, because I agree. So, in terms of your nutritional profiling, red meat uh, is really superior to a lot of other animal foods, particularly the way modern chickens, the types of chicken that's available and pork that's available. Those animals do, unfortunately, they're often fed um, diets that are very, very high in linoleic acid, and therefore the quality of their fat is not the same, and their nutritional benefits are not the same. And so ruminants, particularly if they're eating the diet that they're supposed to be eating, are very, very healthy. Exactly the opposite of what we are told, which is red meat is supposed to be the worst, one of the worst foods you can eat. The opposite is actually true. It is one of the healthiest foods on earth. The only and I also believe that other foods can be nutritious in a carnivore pattern, including certain kinds of seafood, especially shellfish, for people who don't eat red meat or don't aren't comfortable with the idea of eating mammals, eggs, and so that there are other very nutritious animal foods that can be part of that plan. But there is absolutely no question about it that red meat is a very, very healthy whole food, nutritionally complete and safe and highly digestible. And so, but the only caveat I would put there is that I do have quite a few patients, and I myself have had my own issues with this, and that's what brought my attention to it. Not all of us do well with beef. And so in my troubleshooting of carnivore diets, sometimes there have been a few cases where people have come to me eating an all beef diet and not doing well. And now that's not a common occurrence, but it's happened enough times for me to know that I'm not the only one who has this issue. And so, and that's where you can turn to other kinds of red meat, particularly, lamb is an excellent, that's the red meat that I turn to instead of beef. It's not that I never eat beef, but I feel best when I don't eat it. And but I do very well with lamb, for example. And so all of this is personalized, but those recommendations are based on the fact that some of us have food sensitivities that need to be taken into account. Not that there's something inherently unhealthy about red meat, but that there's something inherently different about um, uh, certain of us who have either damaged gut health or immune system differences or sensitivities, which make it harder for us to consume a diet that should otherwise be healthy.
Mm. And you've tried strictly grass-fed, grass-finished beef. You've
Oh,
experimented with all
yes.
of that. Yeah.
Yeah,
Yeah.
absolutely.
Okay.
Yeah. I've tried it all. I've even
Yeah, yeah.
tried extremely, in various of my travels, I've even tried beef that hasn't been aged at all because, as you
No,
may
it's going
know,
to be
beef,
my next question. Yeah.
yeah, because beef is usually hangs for at least 3 weeks, even when it's not labeled aged.
Mm.
And so, because I thought, well, maybe that's the issue. Maybe it's a histamine intolerance because I do have that issue. But I've tried even fresh beef that has not, been aged at all. And while I do better with it, I still feel my best if I avoid beef.
Well, I've got a feeling you would love Australia because we have so much lamb and it's really good quality lamb and it's affordable too. So, uh, plenty of another reason to come down here.
I'm sure I would enjoy Australia for all kinds of
Yeah,
reasons.
yeah, yeah, it's a good place. Yeah. Um, Dr. Eid, I'm curious, in our carnivore diet coaching practice, we don't focus that much on ketones and ketosis. We do focus on eliminating all plant foods. And our hypothesis, which is led by Dr. Chafee, I don't necessarily want to speak for him, but I know he's sort of aligned with this in that naturally, if you're eating a carnivore diet and you're eating when you're hungry, your body will produce the appropriate amount of ketones that you need. That's essentially our approach. So you will naturally be in ketosis, but we don't say you guys have to go get a ketone meter and you need to like really watch it unless you have say epilepsy or cancer or something like that. What are your thoughts on the need for say measuring ketones and also to be in a really deep state of ketosis for mental health?
I love this question because it's a really important one. So the philosophy that you just described, meaning eat fatty meat to satiety, essentially, uh,
Yes.
that 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 philosophy, and this is my opinion, is applies absolutely very nicely to people who are in good health, but it may not apply to people who are not in good health.
Yep.
And so people who are not in good health, particularly poor metabolic health, and particularly if they have quite a bit of damage and compromise to their brain metabolism, they may need to achieve a particular threshold of ketone levels in the blood in order to bridge the energy gaps that can exist when a person has insulin resistance of the brain. It's called
Mm,
cerebral glucose hypometabolism, which means sluggish brain glucose processing, in
mhm.
which there are energy deficits in the brain, that the brain has trouble processing glucose to full capacity for energy, utilizing glucose for energy as well as utilizing glucose for other purposes in the brain. And so whatever level of ketosis you might be naturally achieving by eating to your instinct may not be sufficient to bridge that energy gap. The other thing so when I'm working with people with mental health conditions, and I've consulted with lots and lots and lots of people who follow carnivore diets who are not in ketosis, and they come to me and they say, well, I'm eating fatty meat to satiety, and I'm not getting any mental health benefits. Some people even come and say, I feel worse on this diet. What's wrong? Shouldn't I be feeling better? And the first question I always ask is, are you measuring your ketones?
Mm,
And if they are not measuring their ketones, I ask them to measure their ketones. And what's often the case is that they're simply not in ketosis most of the time. They're zero point 0.4, zero point 0.3 millimole, maybe zero point 0.6 on a good day, but
yep.
they're not achieving reliable, robust levels of ketones that are required to meet their brain's energy needs. And so by making the carnivore diet, adjusting the protein to fat ratio and the absolute amount of protein in that diet to get into ketosis is usually a very helpful recommendation. And the only way to know if that's the issue is to try it and see if that's the issue for you. So if you are following a carnivore diet and you're not getting mental health benefits that you're hoping for, my first suggestion would be measure your ketones. If they're low, change your diet in a way that's going to raise those ketone levels, get into good solid ketosis for at least 6 weeks, 12 is even better, and see if you feel better when you're on a ketogenic carnivore diet and where you've got robust ketosis. Um, and then, it's anybody's guess how long you would need to be there, because maybe there can be some permanent healing that takes place over time, and maybe you would be able to back off eventually and just eat to instinct. But I have definitely consulted with quite a few carnivores over the years who have benefited by intentionally raising their ketone levels for mental health.
Fantastic. And your strategy for increasing ketone levels sounds like increase the fat to protein ratio. What are your thoughts on intermittent fasting and extending the time period between meals to essentially encourage ketone production?
Yeah, so there are lots of ways to raise ketone levels. It's one of the most common things that people come to me to consult with
Yeah.
me about. The most common questions in my clinical training program is, what if the ketones are running too low? How do I raise them? So I go into detail about this in the book as well. But the essentially to raise ketones, you need to lower insulin. So insulin and ketones have this inverse relationship. And so there are lots of different ways to lower insulin. So lowering protein lowers insulin, lowering carbohydrate lowers insulin, exercise lowers insulin, fasting lowers insulin. Those four strategies, and calorie restriction lowers insulin.
Yep.
Just eating less, right? So eating less food, and eating less frequently, exercising more, and So insulin, the foods that raise insulin, the macronutrients that raise insulin are protein and carbohydrate. Carbohydrate raises insulin the most, and protein also, especially depending on the type of protein we're talking about, can also have a decent effect on insulin. But you can't do without protein. You can do without carbohydrate. So you minimize your carbohydrate, that's going to bring your insulin levels down. And then you dial down the protein only as much as you have to get into ketosis. But I obviously am not recommending protein deficit. I'm recommending it's going to depend on the person. So how much protein are they
Mm.
eating right now? Are they eating a lot more than they need? Is there room to go down? Are they already eating a level of protein where I'd be worried about lowering it more? Then we're going to look at fasting, exercise, and other types of strategies to lower insulin. So, um, and then it's a matter of seeing what happens when the ketones rise, seeing if there actually is any benefit to that. Because it can be, as you know, it's hard enough to follow a carnivore diet, but then to restrict what you eat in order to achieve and maintain a level of ketosis, that's another extra level of challenge. And so you want to make sure it's worth it, you know? So if you get benefits, then it may very well be worth it. But if you raise your ketones and you don't see benefits, then it may not, then, it may not be worth it for you.
Mm. I mean, in your experience, how long do you think it takes for somebody to generally see a benefit once they switch to let's say, a ketogenic diet, ideally a carnivore ketogenic diet?
Yeah, so the my mantra is 3 days, 3 weeks, 3 months, right? So some people respond in 3 days, some
Hmm.
people respond in 3 weeks, more average of 3 weeks, and some people may need to wait at least 3 months. And that's why I say you want to give the ketogenic diet a good 12 weeks to see what's possible for you. But most of the benefits are going to start to emerge for most people, not all, sooner than that. Um, and I think the reason for the different response times is that each of us are dealing with a different problem. So if your problem is simply that your glucose levels are running too high, then you're going to see benefits within a few days because it only takes a few days to get those glucose levels into the right range. If your issue is that you have a lot of inflammation and oxidative stress and damage to the brain, that's going to take some time to heal. And so there's the keto adaptation phase, which can take you 2 or 3 weeks before your system really shifts over and your body becomes better at burning fat for energy, and your cells equip themselves to burn fat for energy. That they produce more enzymes and other kinds of molecules, and they ramp up their pathways. And so that can take 2 or 3 weeks typically, where you reach your new equilibrium and your cells are really humming along. That's, I think, the 3 week benefit. But then there are others who have a lot of damage and need time to start healing. And that's where I think some people need to go at least 3 months to start to see some benefit. And so I think a lot of it depends on what's causing the problem in the first place. Is it glucose spikes and glucose instability? Is it that you need some time to keto adapt, or is that you need some real serious healing from a really serious condition? And we're each a little bit different. And there's no way for me to know, no test, at least that I have right now available to me, that can help me predict what the issue has been for you personally.
Mm. Do you think age is a factor? Do you
Oh,
think
yes.
younger people can recover quicker? And yeah.
There's no question about it. I mean, this has been demonstrated in epilepsy studies for years. Children get into ketosis more easily. They heal more quickly, and there have been quite a few children who, with epilepsy, who follow a very strict ketogenic diet for 2 or 3 years, and then they can go back to eating whatever they want, and they never have another seizure again. I haven't seen that degree of recovery in adults with mental health conditions yet in my practice. That doesn't mean it's not possible, but what I generally see in my practice is if somebody, even if someone's been, a very adherent to a ketogenic diet for a long time, and they either intentionally or accidentally have their ketosis interrupted, I mean, it's often the case that the symptoms that they were using the diet to address come back really quickly, often within 24 hours. And unfortunately, and so I think there's just a lot more metabolic flexibility. Kids are a lot more metabolically flexible. They've had
Hmm.
a lot less time to experience damage to their metabolic health, to their brain health. So they bounce back, I think, a lot more easily. And often they don't need the same degree of dietary rigor that adults do, depending on the situation that we're trying to address. So I'm not a child psychiatrist, but when
Hmm.
parents ask me, what should I feed my kids for better mental health? I always recommend starting with a paleo diet. And then if they don't get enough benefit just from cleaning up their diet, because what kids are eating these days is just really toxic. If they just switch to a whole food plan, a paleo style plan, see how far that will go. And, they may or may not need to go any further.
Mm.
But that's, I think, a great place to start.
Mm. That being said, I know of a lot of teenagers and people in their early 20s who have gone all in on a carnivore diet. And I suppose I'm sort of attracted to those people by virtue of running this program. But often I feel amazing. I love this. I look great. I just want to keep going. We do find that quite a bit. And look, I have to say, from my experience coaching people, when they go off track, when they put the coffee back in, when they put the plant foods back in, when the sugar comes back in, 99% of the time, the symptoms come roaring back. And it's just a reminder that it is the food. And if there's ever any doubt, well, you took it away, the symptoms went away. You put the food back in, the symptoms came back almost instantaneously. It's the food. It's absolutely terrible.
You're making such a good point because everybody starts to play with their diet around the edges after a while, right? So that you could get amazing benefits from a diet, and still you're going to start experimenting and say, okay, well, where is the safe line for me, really?
Exactly.
Like,
What
do
can
I
I get away
really
with?
need to be on the, what can I get away with? How strict do I need to be? It's kind of human nature to kind of, play with that boundary. And and it's a wonderful, it's a blessing in disguise when this happens. The symptoms come roaring back, and it's a really good teaching moment. It's like, oh, I this really is the food. This really was the food. I really
Mm,
do need to eat this way. And it's a really good reminder of why you need to be so careful with your diet and how dangerous the standard diet is for people.
yep.
Um, and it's truly dangerous. And so mentally and physically. And so I would love, since you've got so much coaching experience, it would be really interesting to me to hear from you, what kinds of strategies do you find most helpful in coaching people onto the diet and staying adherent to the diet and then kind of getting back on the horse if they fall off. I find that that's a big part of the work that I do
Mm,
with patients is it's not the information. The information's pretty easy to
yep.
share. It's not the intellectual, okay, they get it, right? They get it. It's the actual implementation and adherence and motivation and all of the psychology of behavior change, where at least I find that I find coaches to be indispensable in this work because so much of it is about the psychology of eating.
First of all, we implement a 100% perfectly strict carnivore diet from the start. So
Hmm.
there's no ifs or buts. We try and get people off coffee straight away. No sweeteners, no spices, no herbs, not even pepper. It's just a proper strict carnivore diet. And we find that this removes any temptation or leeway or blurry lines in their mind. And, part of the problem with a ketogenic diet now is that unfortunately all these supposedly healthy keto products have been released onto the
Oh,
market, and you get people eating keto cookies which have got 40 ingredients. and there's all sorts of things in there that they can't pronounce. And the whole point of doing this healthy whole food diet is to get away from that crap, and yet they get drawn in by things like these keto snacks, and that also extends to things like electrolytes, even some protein powders. We really don't think we don't encourage supplements. Of course, you can take supplements if you've done a blood panel and you can see dead and clear, I'm low in B12. Okay, you take some B12 supplements, or ideally just eat some beef liver to try and get your levels back up. But
Yeah.
really, just eating fatty meat, ideally fatty red meat, will restore your nutrient levels to a healthy degree. So, I know it's different. It's probably different in your situation where you've got people coming in specifically for mental health, and they're looking to tackle it with nutrition. Whereas with us, they come in, they want to do the carnivore diet and they want help optimizing it. So we say, all right, we're going absolutely strict. In our community, there's no photos of anything that's not carnivore food. And we also don't encourage things like, eating a heap of sort of carnivore pasta or carnivore pizza, or these things that look like carb heavy foods, but they're made from animal, they're made from pork crackling ground up, or what have you. So we're very strict. And my advice to people who happen to veer off track, something comes in the way, they eat a bit of birthday cake at a party or something, is to get back on the horse and remember that you're not actually starting where you were at the start of the month. You've already experienced, let's say, 2 weeks of strict carnivore. You're so far ahead of where you were before. You know what it feels like to be in ketosis. You know what it feels like to basically have no plants and no plant toxins in your system. So you know that that's desirable. You want to get back to that feeling. You'll be able to get that. You'll be able to get back quickly. You're not starting at the start. So that's kind of like some of the things that we try and emphasize for people.
Yeah, these are all that's all just a gold mine of wisdom there, and it really is that slippery slope.
Mm,
A strict, very simple carnivore diet is so much easier. The rules are easy.
mm,
There's no slippery slope of, oh, how much can I have of this? Or today it's all right if I have that. And it's just okay, this is the plan. I stick to this plan and it will take care of me.
mm,
And there's no fudge factor there. And I couldn't agree with you more about the ketogenic, the sort of the quote unquote keto friendly foods. They're just as bad for us as these sort of processed products as the foods that are not ketogenic and processed. They're just lots of chemicals and extracts and powders and ultra processed ingredients. And so, it's you know, uh, ketones alone, just generating ketones does not a brain healthy diet make. And so the brain needs more than ketones. It also needs nutrients. It also needs to be protected against damaging ingredients like refined carbohydrates and vegetable oils and chemical additives and certain plant toxins.
mm,
And so taking care of the brain is not just about making sure it can generate energy, because in order to generate that energy, it's not about just the right fuel. It's about having all of the components that the cells need to utilize that fuel and take care of themselves. It's about cellular health. And so it's you have to nourish, you have to protect, and you have to energize. It's not just about the energizing piece. And so, and you won't energize your brain properly if you don't have the right vitamins and minerals there in the right proportions. So it is the simplest, and I have found, like you, one of the most effective interventions for people, especially people with food addiction. And people with food addiction experience, sometimes for
mm.
the very first time in their entire lives, complete elimination, complete freedom from food noise and food obsession for the first time in decades. It's
100%.
really
I
remarkable.
wanted to ask you, but I wasn't sure whether food addiction would fit into your sort of remit. So you have people who come to you who are, fully sort of carb addicted, essentially sugar addicted.
Oh, for sure. And not just sugar either. I mean, some people are addicted to there are other foods that they find addictive as well. And so, I mean, I've worked with people who've dealt with food addiction, food obsession, overeating, binge eating,
Mm.
eating in secret, dramatic weight fluctuations on and off every diet, just feeling completely out of control and hopeless and powerless, for most of their lives. And so, for those people, when they experience for the first time complete relief from those symptoms, they don't recognize themselves. Like, who is this? I'm not used to being able to, and I've had this experience myself too, and so that I can speak about it from personal experience too. During the periods of time when I've fallen extremely strict, just as you say, just in my case was meat, seafood, poultry, not just red meat, but no spices, no alcohol, no caffeine, just only meat, seafood, poultry, salt, and water or seltzer. Um, that was the most effective um, plan I had ever followed in terms of keeping my food addiction symptoms completely at bay. And it's kind of a remarkable experience when you've for those of us who've dealt with this for a long time. But in my practice, sometimes kind of a straightforward ketogenic diet that's omnivorous will bring people to that beautiful point of food freedom. But it's more common for a carnivore diet to do that. So a ketogenic diet can quiet a lot of these things, but usually doesn't put them completely to rest the way a carnivore diet can.
Yeah, I think you make a really good point there. Something about the, say, whole foods ketogenic diet, where there's a variety of foods and also some carbohydrates, can still keep that kind of food addiction ticking along. The thing about the carnivore version is, for the first time, people have the opportunity to fully eat to satiety when they get the opportunity. And ideally, it's a very high fat meal, which is really, really satiating. After the
Yes.
meal, there is no blood sugar spike. There is no bloating or heavy feeling because the food digests really easily. And you get this long-lasting energy without without the hunger pangs. And that is so effective at killing the food addiction and that habitual thought of when am I going to get my next dopamine spike from eating the food, which so many people live with. And even just in general life, when I hang out with friends, the conversation will often turn to, well, when are we getting a muffin, or when are we getting a sandwich, or when are we getting this? The whole day must revolve around that. Whereas when you do switch to a ketogenic carnivore diet, that finally quietens, and it's, well, when I start to feel a bit hungry, I'll eat, but the dopamine and the energy and the excitement and the propensity to binge, um, just isn't there. It is such an effective treatment for food addiction. I agree.
It really is. I was working with one gentleman that I've been working with for over 5 years now. And when he tried a carnivore plan for the first time, he said, I feel full for the first time in my life.
Oh
Like I
man.
had no idea what it felt like to actually feel full. And most people with food addiction, they've finished their first meal, they're already thinking about the next one.
Mm.
What can I have? Yeah, finished breakfast. What can I have for lunch? What can I have for snack? What should I bring with me in the car? What do I bring to the office? What do I have in my drawer? And it's just that that's not a way to live.
No way. And I've experienced that too. I used to take like apples and granola bars and things like that with me all the time because I didn't want to experience that hunger pang or that energy crash. Yeah, it is true freedom when you switch to this way of eating. Um,
Yeah.
Dr. Ed, we're running out of time, so I just wanted to finish off by asking you about what's happening in your world. What new developments are you working on? What new initiatives should we be aware of?
Yeah, so there's a lot of really exciting research going on that I'm excited to be part of, and there are also some new kind of innovative resources for people that they can use to help themselves improve their mental health. So one thing is, so there are a couple of different studies that I'm excited to be involved in. One is there's a study using ketogenic diets to in children who have bipolar disorder. So there's some great research going on in bipolar disorder in adults around the world, but this is the first study pediatric bipolar disorder. And some of the early signals we're getting, because it's already underway, some of the early signals that we're seeing are really encouraging. So it's not ready to share. The information is ready to share yet, but it's remarkable what we're seeing in some of these cases. And just wonderful for families to see that. Another study that is has just been that's going to get started this year. This is 2025, getting started at Oxford University. My friend and colleague Allie Houston is the principal investigator. Ketogenic diets for ADHD and major depression. There's never been a study of ketogenic diets for ADHD, and so this is another one of those brand new areas of exploration that I think is really important because lots and lots of people struggle with these kinds of issues. And the other thing to call people's attention to is the Metabolic Mind website, which is kind of a treasure trove of free information and resources and tools that people can use to learn about and get inspired by and even apply to their own lives to try to improve their mental health. And one of the latest projects on that site is a tool called Think Smart, which is where you can learn from people with lived experience, specifically all the metabolic strategies they have used to recover. And because everybody's plan is a little bit different, so that you can see what they eat, you can see what their exercise plan looks like, you can see all the different aspects of their lifestyle that they changed in order to get well. And I think that's really, really a very unique resource and really helpful for people who are looking for guidance.
Yeah, Houston's a fantastic guy. I'm looking forward to seeing the results of this ADHD trial. It seems like every single person these days has ADHD. Yet, as we've been talking, I'm sure their brain is in a really unhealthy state from the food they've been eating, or and the lack of nutrients. Certainly, they're not in ketosis.
Certainly not. Most people are not. And so, yeah, I really appreciate you inviting me for this conversation. Thank you so much.
My pleasure. And please check out Dr. Ead's book, Change Your Diet, Change Your Mind. A fascinating read, and something that's certainly putting metabolic psychiatry out into the mainstream. And I really appreciate the work that you're doing. Congratulations again on appearing on Diary of a CEO podcast. It's not quite as big as the How to Carnivore podcast, but it's something. Yeah,
I've loved being with you anyway. It's really not about the size of the podcast. It's about reaching new people, right?
yeah,
So
yeah.
being able to reach as many people as we possibly can wherever they are, so that especially people who are looking for hope.
Absolutely. Dr. Ead, thank you so much.
Thank you very much. I hope you have a wonderful day.